What are the effective lifestyle changes to get the most out of your TRT? We'll have more with Dr. George after this. So keep watching. So hi, we're back with Dr. George Touliatos with Balance My Hormones and another question time with Dr. T. And we're here to talk to you about the effective lifestyle changes you may need to implement when you start your TRT treatment. So Dr. George, as a doctor who treats TRT, what are your recommendations for patients when they're starting TRT as far as other lifestyle changes they should be aware of?
Now, since TRT is the basis of anti-aging and replacement therapy and replacement hormones, and actually HRT, apart from the major androgen testosterone, then we have other hormones that we mentioned in the previous episode. You have to follow a proper healthy lifestyle in order to get most out of this. So for instance, it's not useful using testosterone and other hormones and then sleep out at night, doing narcotics and consuming alcohol, smoking marijuana, and expect them to have vitality and to perform better in your life generally. So you need proper sleep in order to have REM sleep 11 to 7 and some decent growth hormone production. Then you need not to consume alcohol because alcohol aromatizes in the liver and elevates estrogens. Aromatization is linked with estrogens. Not smoke marijuana because it elevates prolactin. Not use opiates because they also elevate prolactin. Stress also, you have to to manage your stress because cortisolemia affects natural testosterone production. Of course, you are plagued with testosterone, but also cortisol may heat up your muscle and produce some mental fat. And also stress is a reason for elevating prolactin. Now, other things would be, of course, to follow a proper diet, such as a Mediterranean diet, plenty in saturated fatty acids, lean animal protein, vegetables, also some fresh fruits, but also skip from saturated and mainly trans fat, which is not good for the endothelium of the arteries,
Or like the Skippy peanut butter or any of the peanut butters that have a...
Yeah, I prefer organic peanut butter, which is salt and mainly sugar-free, but it's not, so bad quality such as the Skippy. Do you like it smooth or chunky?
I quite like it chunky though. I find it's a nice texture, but I haven't had it in ages, really. I don't eat a lot of peanut butter. It's a lot of extra calories. And you can also go to Costco and get some almond butter as well, which is nice.
Cashew butter also is great.
So not bad. I've usually just, I don't eat much of it anymore. My diet's pretty much meat, but meat and greens and sweet potatoes and chicken, have a mix of red meat.
But you told me that you avoid gluten, eh?
Yeah, but I avoid gluten and dairy because I don't have celiac disease that runs in my family. And
Can you eat parmesan cheese?
Very little. I haven't had it in ages, to be fair. So, but no, I've had to manage my diet over the years being on TRT, and one of the things I've recently had to do because of the thyroid was, eliminate gluten and dairy, and it's made a big difference, both with my gut health, as well as general energy. So I'm really glad I made the change, and it's not as hard as you think it is, especially, well, I guess at lockdown, you buy your own food, you're not going out to restaurants as much. But there were certain types of restaurants I can eat out at, like I can have an Indian curry, I can have Thai. You can find things on menus, and it's very doable. But I mean, that's just kind of part of the lifestyle changes you need to make to optimize your health. What do you say about training at the gym? Training at the gym. I mean,
absolutely, yes. For a better hormonal profile, but also for a proper body composition. Okay, to lower mental fat, to build muscle tissue, to improve insulin sensitivity, to kick growth hormone and testosterone production. Okay.
Do you think there's too much pressure though on men and people in general to be out there constantly in the gym? Can it sometimes lead to overtraining even on TRT?
Yes, of course. Being a gym rat is not productive, because you overtrain, you get burned off mentally and physically also. And it's a major factor for hinder gains and improvements, actually it's a drawback. And yeah, as Dorian Yates said, so we grow when we sleep, and we feed our muscles in the kitchen, and we just we punish our muscles in the gym, and then we expect them to grow after rest and proper diet and supplementation, okay, and rest, of course, yes.
So I guess.
So, yes, it's not productive. Overtraining, you destroy your muscles, and also if you're natty, then cortisol will lower your testosterone production, okay.
Right, but then testosterone, when you're on treatment, can also lower your cortisol production, as can some.
Yes, because they're antagonistic. Corticosteroids and androgens, they're antagonistic.
Yeah, and as is a human growth hormone as well, I think, can bring down your levels of.
Growth hormone actually suppresses myostatin.
Suppresses myostatin.
Myostatin. Take a plethora of supplements that support cardiovascular.
Oh, that's a good. So other vitamin supplements. So yeah, you've talked about that before.
Yes.
Especially the heart healthy supplements.
Yes. We have two different types of supplements: the performance supplements and the health supplements.
So which ones are the performance supplements?
It's creatine monohydrate.
Okay.
It's BCAAs and leucine mainly, HMB. Hydroxymethylbutyrate.
Oh, you're taking me back to the 1990s, George.
Yeah, the Bill Phillips. Yeah.
HMB. So creatine, whilst we're on the topic, when we see blood levels, we see that creatine is a precursor to creatinine. And
creatine is a tripeptide. It consists of 3 amino acids.
So if you have patients on creatine monohydrate, is it safe to say that those increases in creatinine on their blood tests?
Yes, but they have to hydrate more, because creatine monohydrate works through osmotic effect, and osmosis is the transportation of components from a hypertonic to a hypotonic. But creatine monohydrate works with very good hydration, and this is why it leads to this swelling of the muscles, and then you get edema, okay, for the influx of nutrients, but also you require good hydration. And another reason is because if you don't hydrate enough and you take creatine, your creatine is more likely to elevate. Now, the word meat in Greek is kreas. It's the result of creatine, the etymology. So if you consume creatine, especially if you load on creatine, which is 20 grams a day for 5 days, it's more likely to elevate your creatinine.
Okay, so this is something we need to be aware of, and ask the patients if they have been using creatine supplements so that we can put that into context, so that people aren't panicked thinking they've got serious kidney damage, which is usually the bit of.
But as creatinine elevates, then GFR goes down. So you have to take away creatine and red meat for a while to lower your creatinine. Hydrate well, of course, in order your GFR to elevate. So it's some factors that affect this.
I think we ought to just run our own laboratory, get our own reference ranges based on patients who are taking these things, so that we can have a more accurate idea, because there's nothing worse for a patient to get their blood test levels back and think, oh my God, I've got all these different problems going on, and they panic a little bit. And
also, overtraining, doing heavy leg session the day before, will elevate your transaminases and your CPK.
And the CK, creatinine kinase.
Also, your white blood cells, also, because overtraining is an inflammation,
It's true. So I guess, going back, not to sound cliche, but everything in balance would be helpful.
Balance my hormones, balance everything. It's about,
balance my life. That was a really good topic today, George. I think I'm going to buy some peanut butter going forward. So that's Dr. George's thoughts on lifestyle changes when you're on TRT. Thanks again for coming on to another episode of Dr. Touliatos' Question Time. Thanks again for watching. Press like if you like the video, and please subscribe to the channel, and we hope to see you next time.